Okay, so let's talk about the role of a doctor. This is a common question that can be asked in your interviews. This tests your insight into medicine. A lot of the times, what interviewees do without proper preparation is they focus on the clinical aspects of the role of a doctor. For example, taking a history and examination, diagnosing, ordering tests, analysing results, and being involved in the management plan. This is important to mention and adds a lot of value to your answer. However, they tend to forget the other parts of a doctor's role. This section will focus on the other roles. This can be something which you can say in addition to the clinical commitment, and it might help differentiate yourself from other applicants and impress the interviewers. What is an audit? Think about it in a few seconds. So, a lot of the time, doctors will be involved in audits or quality improvement projects. This forms part of your portfolio as you work through training programs. A lot of the times, doctors will be involved in an audit or a quality improvement project as you often need this to progress in your training. It takes many years after graduating medical school to become a fully qualified GP or a consultant in a hospital. So an audit is basically a quality improvement cycle which aims to see how we can improve our clinical practice and meet the requirements from a guideline. This can be a national guideline that's been set, by example, from NICE, the National Institute of Health and Care Excellence. Don't worry, we'll go over the important organisations that you need to be aware of later in the course. An example of this is adults admitted with a medical emergency have a structured patient handover during transitions of care. So an audit will typically involve collecting data based on current practice and then making changes that aim to improve clinical practice over a period of time. Collect data again to see if these changes have improved the practice based upon the guideline. An audit is a continuous cycle of improvement, and so then it would start all over again. It's important as healthcare professionals, we need to constantly and continuously develop the way clinical practice or our system works to improve patient outcomes. So the next part of a doctor's role involves research. A lot of times, even as a medical student, you'll get involved in research. This also forms part of your portfolio and is assessed when you're applying for further specialist training. Doctors who are academic, i.e. professors, those in an academic training pathway, consultants, junior doctors, they'll all often be involved in research and publishing multiple publications to help improve scientific understanding of certain subject areas. Research can be in different forms. So, for example, a literature or a systematic review to help improve our understanding on a particular subject, i.e. health conditions, developing new drugs, such as those involving human or animal trials, and the list goes on. You do not need to know research in much depth. You'll learn more about this in medical school, but a basic understanding of what it will involve is important as it can be tested in your interviews, especially those universities that are research focused, such as Oxbridge. What you need to know is research is about expanding on our current knowledge through looking and reviewing new literatures, and it involves developing new ideas or hypotheses and testing those ideas through various methods which can generate new knowledge, discussion, and applying our new understanding into practice. We are living in a world of constant scientific development, which all can help improve patient outcomes. Medicine itself will involve a constant learning process. You can't finish learning about medicine completely. It's so big and there are new things developed or discovered every day. There are exams that you need to pass to progress in your training as a doctor. There are competencies that need to be signed off. As you work your way up, there will be more junior doctors and medical students who you can teach. This is part of your profession, which will involve teaching others and developing those around you. This also expands to other healthcare professionals within the multidisciplinary team. Even for patients, as a doctor, it will involve teaching them about their diagnoses and their management plan, through a patient-centered approach. This might be done formally or informally, and it can also be part of your portfolio, which you need to show evidence as you progress through your training. So, continuous professional development. As a profession, we're constantly learning new things. This can be done through being taught by others in your working environment, going on courses or going to conferences, reading specific journals, etc. We always want to ensure our knowledge is up to date and constantly improve ourselves to help improve patient care. There are exams to revise for and to pass during your training, which can take a big chunk of your time. For revalidation purposes, you need to show evidence of continuous learning in order to continue to practice as a doctor. Very often, as you progress as a doctor, you'll get more involved as the team leader, especially if you become a consultant within a hospital. And a lot of your time will be involved in making departmental decisions if that was the case. If you're a GP partner, you'll often be involved in almost everything within the GP surgery. Since you're essentially a business owner, you have to ensure that you've got good finances and accounting to run the practice. You'll need to ensure staff are well managed and trained for their roles, ensuring that good quality care is provided to the patients, ensuring that IT systems and equipment are working effectively and fix them if they don't work. Another role of a doctor is health promotion. Doctors can participate in writing articles. Sometimes you might see them going on TV shows or television to share their thoughts and educate the public. For example, to bring awareness, maybe like something around smoking cessation, eating a healthy, balanced diet, or ensuring that the voices of doctors are heard. It can also be discussing a certain condition and clarifying any topics, etc. The list goes on. This is a great way to reach a bigger audience and have a greater impact on health.